On June 1st, a gunman in Tulsa took the lives of 4 innocent people at St. Francis Hospital before killing himself. A horrific example of what is becoming a disturbing trend: threats or actual violence against hospital workers. 2 doctors, a receptionist, and a patient died that day. And since then, more threats have been made against hospital employees in Tulsa. This week, Rich Lynn spoke with reporter Catherine Sweeney with our content partner State Impact Oklahoma to learn more about her recent article on workplace violence in healthcare facilities.
Catherine, you wrote about other threats following the Tulsa shooting. Can you give us some specifics on that?
One person called their doctor and said he was going to shoot him and his other doctor and anybody he ran into on the way. Another man at a hospital was angry about the food he got and said he was going to shoot whoever made it. The same man threatened to shoot whoever lost his glasses while he was there. But St. Francis, St. John, Hillcrest, each of them have gotten threats of shootings.
Thankfully, those were only threats, but hospitals may be the ultimate soft target. Explain that.
There are so many entrances in hospitals, and there are stairwells where people can hide, and they are just really laid out in a way that it's hard to secure them.
And in addition to that, of course, the obvious, doctors and nurses are facing people who are not well, perhaps physically as well as mentally.
Especially in an ER, people can come in after a traumatic brain injury and they can be acting so different from how they usually would, or after a bad drug interaction. And not even just illicit drugs, but prescription drugs that maybe didn't mix well. People can come in, again, with a personality that's altered, and they can be a lot more aggressive. You're seeing the patient and their family kind of in one of the most vulnerable situations that they'll ever be in. And so the tensions are just very high. And then also, yeah, they can be having a medical condition that can make them act differently than they usually would.
Catherine Sweeney with State Impact Oklahoma. Is this happening all across the country? Is the problem growing?
We know that hospital workers and health workers generally already face violence at the workplace at a rate that's 6 times higher than just the general public. But it did get worse. And so that study found that of nurses who work in hospitals, they surveyed hundreds of them, 44% had experienced workplace violence, physical violence. More than 2/3 had experienced verbal abuse, but 44% had experienced physical violence on the job.
Catherine, those numbers are very disturbing. Now, we've been talking about patients heading into hospitals, but also what about healthcare workers who have to head into a home, a private home? That can be dangerous too.
I talked with a hospice social worker, and she kind of talked about these stresses of going into a person's home because you don't know if they have a firearm or another weapon and you're on their turf. She said during these really bad surges where a lot of people were packing the hospitals, there were shortages of workers, there were shortages of doctors, hospitals were past capacity. It was just a really hard time to deliver care. So patients sometimes were not getting as much face time with their doctors as they usually would, and they would have terminal cancer and not be super clear on that until a hospice worker showed up, and they would say, I'm here because your family member only has a few weeks left to live, which of course, finding out a loved one is dying very suddenly in a confusing way can be very emotionally charged.
Catherine, back to the hospitals, armed guards, metal detectors, is that the answer? Is that feasible?
There are people who talk about physical security, armed guards, metal detectors. There are people who talk about just like workforce training, and then there are organizations that do advocate for stricter gun laws. Oklahoma has already adopted a law that really further punishes people who do assault health workers. So it was lifted up to a felony, and then the maximum punishment was lifted up to 10 years. There is a movement trying to push for laws like that to protect health workers. There's not one solution that could fix the whole problem. It's just a very tough issue.
Catherine Sweeney with State Impact Oklahoma, thanks again so much for your time.
Thank you for having me.